I would say the fact that you build so many strong relationships with the faculty, with some of your classmates. You realize that it is a small school, but that's actually a benefit because you're able to have that hands-on time with your other classmates and having the professor right there seeing the things that you need to correct, or if you need to think about doing things this way. If you have any questions about any class and you're not sure about what's going on, you can always stop in. They're always there, and they're not bogged down with having a ton of students there coming to their office all at once. And so they're always readily available. The staff that works in the department is great, and they're always working together with you too, and they know if you want to succeed, they want to help you succeed too. And so even after you finish school, I mean, they continue to stay in touch with you, they continue to want to know what's going on, and they want to make sure that you succeed even after you're done there, and make sure that you represent the school well. So I would definitely say that is one of the big strengths of going to UMES. So.
I chose UMES PT for several reasons. One of the biggest reasons was tuition. It was cheap and in-state. Maryland only has 2 state schools that offer PT, and I ultimately chose UMES based on the reputation of manual therapy and orthopedics.
I got most of my experience in my clinicals and my affiliation at the end. I really felt, good about it. I was just like, okay, I'm going in here head first. And it's always good to look around at what everybody else is doing. And sometimes you pick up a lot of pointers that way.
I felt extremely prepared, especially for what I wanted to do. I always had the interest in orthopedics, and so we really had a strong background with that while we were there. Everything was evidence-based, and of course we all remember with having to stay up on the research articles and preparing and actually applying that to what we were doing in the classroom, whether it was a manual therapy technique or therapeutic exercise. We made sure that everything that we did was based on the evidence, so that was definitely a huge benefit to going to school there.
I've learned that research is very difficult and it takes a long time. I have a lot of respect for people who do it on a consistent basis. I did my project on lower back pain and the psychological issues associated with it, and I feel like I just have a better understanding of all the psychological problems that come with being in pain, and I'm better prepared for treating patients who are in pain.
Well, I'm actually in a hospital-based outpatient setting at this time. We're treating a lot of patients, a lot of Medicare, mostly all outpatient. I have a couple sports injuries that I'm doing. I love sports injuries. I have so much fun with those kids. We're just doing everything, total knees, backs, totally. It's hospital-based, so the Medicare cap doesn't really apply to us. It's very open. There are a lot of therapists there. It's actually 5 therapists, 4 PTs and a PTA, and we're all very hands-on, very one-on-one, do a lot of manual stuff, things like that.
In an outpatient orthopedic setting, and so we see various sports injuries, low back pain, we see cervical pain, different peripheral joints, of course, and so we see different age groups. We'll see anything from, I guess, as low as 10 years old to, I had a patient today that was a little bit older than that. So we see a wide variety of age ranges there, and so we see, it's mostly orthopedics. We really don't see any neurological disorders. So.
I think the most interesting experience I've had is we had a patient come to the Balance Center in Cambridge who had positional vertigo, and we did the Dix-Hall-Pike maneuver on them, and they were positive. And then we did the Epley maneuver, and she was fine. A couple days later, and she had no vertigo, and she was walking perfectly.